Hello viewers, welcome to Doctor's channel. Today Dr. Siva Charan Reddy is with us, consultant gastroenterologist and colorectal surgeon. Hello doctor.
Hello.
Doctor, could you tell us what is fissure?
Fissure is nothing but an ulcer. So fissure is nothing but a defect or a small ulcer which is developing in the epithelium. Right, this happens in the anal canal or at the anal verge, to be precise, and this most commonly is because of constipation, and even more commonly because of straining. When the patient passes hard stools, they have to strain and they have to put a lot of pressure to get the stools out, and in this process the stool makes a cut or an ulcer at the anal verge, that is right at the outlet of the anal canal. So once this cut forms, patient has severe pain, patient has bleeding while passing motion, and they are in excruciating pain. They even hardly are able to sit down, they are not able to walk, and luckily for them most of the times it reduces spontaneously, but if the cause is not corrected, it comes back again, and their lifestyle is severely hampered. They basically beg for the doctors to do something.
Doctor, could you explain us how do they develop?
Yes, like I said, the most important cause or the most common cause of a fissure is passing of hard stools and straining while passing stools. So again, when you it's the simple example is if you are passing anything hard through a soft mucosa or the soft lining of the intestine, this hard thing cuts across, makes a cut in the joining or at the important places of this mucosa, and when it cuts through, it causes bleeding, and then like any ulcer anywhere in the body can produce severe pain. So this pain is more even so because patient has to pass stools to survive, and once they pass stools, this prevents them to pass stools. In fact, it increases the constipation also. They hold back passing of stools because of pain, because of fear of having pain because of fissures, and this pain or this induced constipation makes it even a bigger problem, because the constipation increases, the fissure also doesn't tend to heal, so it adds one on top of another. The fissure leads to constipation, constipation causes fissure, so it's like an endless cycle. So unless the constipation is resolved, the fissure will never heal.
Are there any signs and symptoms, doctor?
Yes, the most common sign or symptom or the most common complaint the patient comes to us is with severe excruciating pain while passing stools. It starts off as that, and then the patient has pain even while sitting normally or even while standing up, walking. Even they are impaired to an extent that they are not able to do any physical activity. So this manifests as many other problems also. These fissure patients have high levels of irritation, they have sleeplessness, they have high levels of stress because of this. So there are a chain of symptoms that happen along with these fissures. So another important symptom or a sign of these patients is they notice blood while passing motion. Typically when they pass motion, at the end of it they notice couple of drops of blood and they are worried. Most commonly they are worried, thinking that it could be cancer, and then they come to us at initial stages thinking that we are passing blood in motion, please help us, what is going on.
Okay, doctor, could you tell us, and what do you suggest, what type of medical management do you suggest in this condition?
Yes, medical management for fissures mainly consists of two things. One is to reduce constipation, which is a causative thing. The second thing is to reduce symptoms. So to reduce constipation, we give medicines, we give advices like dietary modification, as in improve a lot of fiber in the diet, taking plenty of liquids and water in the diet. And medical management to decrease constipation would be adding medicines or adding fiber into the diet, like laxatives. A lot of laxatives are available, which are available across the counter. So these can be taken to smoothen the stools or to increase the ease of passing of stools. They can be done, and to reduce the symptoms or signs, to reduce bleeding and the ulcer per se, there are medicines, there are creams which are available which reduce or heal the ulcer faster, reduce the pain which is caused by these these ulcers and fissures. So medical management is largely successful, and with the medical management itself, most of the fissures can be healed to an extent that about 90 to 95% of these patients with fissures can be treated medically. Very few do not respond to medical management and require surgery.
Are there any surgical management is available?
Yes, surgical management is like a last resort or the last thing that we do, that we advise to the patient. Only when the medical management fails, or if the pain is very severe that the patient is not able to pass stools or is not able to do any normal activity, only then we advise surgery. The surgery is a very simple surgery. It is called a sphincterotomy surgery, where we cut the muscle surrounding the anal canal to a very small extent. About 15 to 20% of the muscle is cut, and then this relieves the pressure around the anal canal and helps in passing of the stools also. The pain is much relieved immediately after the surgery, to an extent that about 95 to in fact 100% of the pain is resolved immediately post surgery. So this there are again various methods of doing a sphincterotomy. We are using laser now to do a sphincterotomy, wherein we do the surgery, and in half an hour, 45 minutes, the patient is back to doing his routine activity and is absolutely pain free after the surgery, and then he can go back to his routine work a couple of hours after the procedure.
That's great, doctor. Can we prevent this?
Yes, again, the most important cause or the most important thing which leads to fissure is constipation and straining while passing stools. So these can be largely prevented by following a very healthy diet and taking lot of fiber in the diet, and doing basic minimal exercises. Or some patients who have chronic constipation, if they can start treatment for that, take proper medications, fissures can largely be prevented in almost all the patients.
Any diet plan should they follow?
Yes, like I said, any food which is rich in fiber and any food which is hard to digest. Red meat is always hard to digest, and it could be avoided or reduced. Or when they are taking non-vegetarian food, they should make sure that they take lot of fiber food along with it, take lot of salads or vegetable or fruits along with it, drink lot of water, and try to reduce it. And if the fissure is already there, these patients should take precautions. They should avoid taking lot of fatty food, avoid lot of masalas and spices, which will increase the symptoms.
Yeah, thanks for the useful information, doctor.
Thank you.
This episode will continue. If you found this video useful, please like, share and subscribe to our channel. For more info, visit our channel. Thanks for watching.